Hey guys, this is Dr. Shivam, and this will be my attempt to make you know the recent NBE pattern, that is the clinical scenario. So nowadays your studying from guidebooks or normal theoretical knowledge is not helping you that much in your NBE pattern exams. So you must update yourself with the recent teaching because most of it is now a clinical based scenario which are being asked in your examination. So I will be teaching you through my YouTube channel some of them so that you can help in getting answers while you are in examination. Now this is sort of similar picture you have seen this year in your NBE examination where a bulged out tonsillar tissue was seen in the picture and they had asked you the diagnosis. So in that case it was peritonsillar abscess, and sort of similar cases will be asked in your future examinations also. So this is a similar type of picture which was given in your examination. So you should know which all things can be asked and which are the most important things you should know in every subject. So today I will discuss with you one important such clinical scenario. I have made a list of them. Will discuss with you eventually so that you can utilize your lockdown period efficiently and take over from others while other people are taking rest. So you should keep on giving your extra efforts every day, like I say to all my students, and keep pushing your limits. So today we will discuss a scenario of a 34-year woman presenting with gradual onset of bilateral hearing loss. What is important here is there is no tympanic membrane perforation. So with bilateral conductive hearing loss, most of the people will think like the patient will have a tympanic membrane perforation. But when you examined her tympanic membrane, it was normal. There was no tympanic membrane perforation. But still, the audiogram which is given here was showing you a dip in the bone conduction. So basically, they want you to ask, describe the findings on this audiogram. Why the patient is having bilateral hearing loss with normal tympanic membrane. What is the most likely diagnosis that comes in your mind, and list 4 treatment options that you will give on basis of your diagnosis. What other investigation would you perform? So if you see this audiogram which is now being asked in sure manner for your examination, I have already discussed the audiogram video. You can watch through my playlist on my YouTube channel. So there is a dip in the audiogram at 2000 Hertz, and you know that this is a peculiar feature of audiogram with otosclerosis. So for you, for time being, this dip at 2000 is for otosclerosis and dip at 4000 is for noise induced hearing loss. What is for you to note that is this dip will be in the bone conduction line. So this is basically a right conductive hearing loss with Carhart notch. So narrowing of ear bone gap at 2000 Hertz due to dip at the bone conduction in 2000 Hertz. Most likely diagnosis is otosclerosis. In otosclerosis, the 4 treatment that you should offer to your patient is observation, fluoride therapy. For active otosclerosis, we will discuss what is active otosclerosis, hearing aid, and stapedectomy, or nowadays stapedotomy. Stapedotomy is different from stapedectomy that we will discuss. What other investigations you would perform? So basically you can perform a tympanometry which will show you a AS type of curve. So this is a peculiar situation when you will find your patient having conductive hearing loss, ear bone gap, and the tympanic membrane is intact. So not confusing, this is otosclerosis. Now once we know this otosclerosis, we should know everything important about it, and you would love to know that this otosclerosis is one of the favorite topic for ENT surgeons. So it is favorite, and hence it is important for you to know every bit of otosclerosis, because whatever questions from ENT are going to be asked, they will be from some high yielding topics. So you should know, you should try to grasp all the high yielding topics from every subject, because each subject requires 3 years of study, minimum 3 years of study to get its basic. So you don't have that much time, and you should focus on high yielding topics from each subject, and otosclerosis is one among them. So basically, otosclerosis is one big topic which I will discuss in another video, but in this video I would like to make you know some important MCQs related to it, some important points related to it that you need to know. So it is a hereditary localized disease of bony labyrinth characterized by alternating phases of bone resorption and formation. So what is happening here? The normal dense endochondral layer of bony otic capsule is replaced by irregularly laid spongy bone. The normal dense endochondral layer of bony otic capsule is replaced by irregularly laid spongy bone. So I have repeated it 2 times so that you get it. Now these are the MCQ which you should know. It is autosomal dominant in 15% of cases. I will repeat, it is autosomal dominant in 50% of cases. That is, in most or 50% it is autosomal dominant. One MCQ. Now females are more than males, that is the ratio is 1:2. Age group is 20 to 45. Age group is 20 to 45. Now whatever I am repeating twice, that means it is an separate MCQ for you. Puberty, pregnancy, menopause accelerate this condition. Triggering factor is viral infection. Races white greater than Negroes. Races white greater than Negroes. More in Caucasian. More in Caucasian. And mostly bilateral. Otosclerosis mostly bilateral. Most common site is fistula antre fenestrum. Most common site is fistula antre fenestrum. That means anterior to the oval window. So this is the most common site where otosclerosis occur. That means the stapes foot plate at this site is most commonly found to be fixed, and that is the result we get conductive hearing loss, because now the ossicular chain is not able to vibrate and conduct the sound, because the stapes foot plate is fixed and it is not able to vibrate to transfer the sound vibration into the inner ear. So round window area, other sides are round window area, stapedial foot plate, internal auditory canal and semicircular canal. There are different types of otosclerosis: stapedial, cochlear and histological. Histological type is basically detected in postmortem at autopsy. Stapedial is the most common one. Cochlear involves round window, and stapedial, which is most common, has fistula antre fenestrum as most common site. Now these are some things that we will discuss separately in a separate otosclerosis class. What you need to know is the low frequency conductive hearing loss, Carhart notch, negative Renes, diphasic or absent acoustic reflex. So normally this Carhart notch is the thing which you need to note in the audiogram, and it disappears after successful stapedectomy. Now there are some important MCQs which I was telling you should know is these. Don't worry, I will discuss it in separate class, whole of the otosclerosis. Now otospongiosis is inherited as otospongiosis. Don't worry, it's a different name or another name or previous name of otosclerosis. So now you know it is autosomal dominant. I have repeated it twice, that means it is a separate MCQ. Otospongiosis, otosclerosis is autosomal dominant. So you all know, I am not reading this. Most common site of otosclerosis is oval window, round window, utricle, ossicle. Most common site is oval window, because stapes foot plate is fixed at that point. Most common site of initiation of otosclerosis is, so basically most common type of otosclerosis that we were talking. So this question will be solved by this one. Most common type, you know, stapedial. Most common site is fistula antifenestrum, which is just in front of the oval window. Most common site for stapedial otosclerosis is fistula antifenestrum, and most common site for cochlear is round window. Clear? Most common type is stapedial. Among stapedial, the most common site is fistula antifenestrum, and among cochlear otosclerosis, the most common site is round window. Most common age we have already discussed. It is 20 to 30 years. Between 20 to 30 years is the most common age that is being asked. So I was telling you these are the things which have been or will be asked, that is from each important topic some important points will be asked that you should emphasize and revise frequently. So the main funda is you cannot remember everything from all the 19 subjects. Try to know what are the important high yields from every subject. Don't neglect any subject, and from those high yield topic, know and revise repeatedly the high yield point from each topic. This will help you in your final revision, in your fast revision, and getting more right answers in your exam. And now the main focus should be concept building rather than just cramming everything from your notes. So understand things, it will help you to keep things for longer time, and it will reduce your mistakes in your final examination. Okay, so for more guidance you can contact me on my WhatsApp. I would love to help you all, but the thing is, if you don't work, if you don't take effort, nobody in this world will be able to help you. So take effort, find your weaknesses, find your gaps in your preparation, and I am sure you would be able to achieve what you are targeting this year. So this answer I would like you to comment in the comment section of the video. Otospongiosis causes unilateral conductive deafness, bilateral conductive deafness, unilateral sensorineural or bilateral sensorineural. I would love to answer it in the comment section, and would love to know that how much you got from this video. This is Dr. Shivam signing off. Till then, stay happy, stay healthy, and keep moving forward. Thank you.